All right. Hi, my name is Caleb Martinez. The study I decided to choose for this assignment is Physical Activity and Cognition in Sedentary Older Adults, a systematic review and meta-analysis. This is phase 1, Benefits of Physical Activity, and the section I chose to write it on is Cognition in Older Adults. This is the citation for the article that I chose. And then these are the list of major affiliations for some of the authors of this article review. Introduction. The overview of this article explores the relationship between physical activity and cognitive function in sedentary older adults. With increasing global aging and a rising number of older individuals leading sedentary lifestyles, cognitive decline has become a significant public health concern. This research highlights the importance of lifestyle modification, particularly introducing physical activity into daily routines of older adults as a potentially effective low-cost intervention for maintaining or enhancing cognitive health. The purpose of this article, the aim of the systematic review and meta-analysis is to evaluate and synthesize existing evidence to see if cognitive outcomes can be improved by physical activity in older adults. This article to assess the impact of physical activity interventions on cognitive functions in sedentary older adults to provide evidence-based recommendations that could guide future clinical practices, public health strategies, and policy making aimed at reducing cognitive decline in aging populations through non-pharmaceutical means. All right, this is the method slides of the assignment. On the right, we have imported a chart that shows the identification, screening, eligibility, and inclusion that was used inside the article. So for the design of this article, they used the systematic review and meta-analysis with Prisma. For the search, systematic literary search performed on PubMed, Cognitive, or the Cochrane Library, Web Science, Sinomed, OVID, and 3 Chinese databases, Wanfeng Data, VIP, and CKN5. The authors used keywords to concisely choose which articles they wanted to use. These keywords included cognition, cognitive function, exercise, meta-analysis, older adults, physical activity, sedentary behavior. The inclusion criteria included 6 different aspects. The first was design, which is RCTs had an exercise-only intervention in the experimental group and non-exercise group. For number 2, eligibility of participants, subjects aged 60 or older with or without cognitive impairment and living a sedentary lifestyle. Number 3, eligibility criteria, articles examining the association between physical activity and cognition in sedentary elderly adults. 4, sedentary behavior. Studies were included as long as they included older adults with sedentary lifestyles, regardless of the sedentary criteria. 5, outcome measurements involved global cognition or other specific domains such as memory and executive function. And number 6, only articles published in English or Chinese were used. All right, for data extraction. This was performed through a structured process that used publication year, author, journal, number of experimental and control groups, interventions and time, outcome indicators, and cognition assessment models. Studies were imported into EndNote for initial filtering. Document screening and data extraction were independently performed by 2 researchers with third-party arbitration for inconsistent results. For the analysis, the meta-analysis follows statistical procedures and measured effect size heterogeneity, subgroup analysis, publication bias, and sensitivity analysis. All right, so for the results section, 7 RTCs comprised of 321 sedentary adults included in the meta-analysis. Experimental is 164 and control group is 157. So I've provided 5 forest plot charts to show the significance of physical activity on cognitive health. So for the primary outcome of this article, it shows that there was a significant result on physical activity on cognitive health. The standard mean deviation is 0.50. Confidence interval is 95% with a range of 0.09 to 0.92 with a p-value of 0.02. There was also multiple subgroups that were tested as well, and those results were baseline cognition, significant results for the combined effect. Standard deviation, 1.84, confidence interval is 95% with a range of 0.62 to 3.06 with a p-value of 0.03. Intervention duration was more than 12. Intervention duration of more than 12 weeks led to a significant cognitive improvement, and that's shown with the standard deviation of 2.85, a range of 0.73 to 4.96 for the 95% confidence interval, and then the p-value is 0.08. There's also significant results on physical activity forms, especially aerobic exercises, that showed significant improvement, as well as by country. And for the country, it shows that improvement is found better in countries outside of the United States. All right, so for the conclusions, most important to least, physical activity improves cognitive function. 2 combined exercises, aerobic and resistance, yields best results, and duration matters. Longer programs have greater impact. Connecting to other research identifies the gap in understanding how exercise impacts the brain, shows real-world potential of interventions, and highlights variability in adherence and outcomes. All right, so to continue conclusions, the strengths of the study: conducted comprehensive search using 9 different medical databases. All studies were RCTs, measured subjects, general characteristics at a baseline. Comparability was good, bias was low, and external implementation of results was strong. Despite the heterogeneity observed in the study, the consistent results indicated findings are reliable and robust. So for the weaknesses, is the total number of articles used was small, as well as the total sample size. Limited to articles only in English and Chinese. Inconsistent assessment tools for cognitive outcomes indicators may lead to bias in actual size estimates, but this is unavoidable due to lack of literature. It is not possible to determine how physical activity might affect specific cognitive domains in sedentary older adults. And then lastly, it did not publish or register a study protocol. All right, so for future studies, in future studies, there are several areas in which further research is needed, such as observing more long-term effects, standardize of protocols, specific cognitive domains, dose-response relationships, and underlying mechanisms. For the author's take, current evidence suggests that PA has positive effects on cognitive function in sedentary older adults. An intervention more than 12 weeks in aerobic exercises can effectively postpone cognitive decline. Based on the article, the author suggests the author suggests that older adults should reduce sedentary time as much as possible and exercise regularly. For my personal take, physical activity is an effective way to prevent a decline in cognitive function for older adults. It will help us future treat adults, as a huge portion of the population is going to be reaching the age of 60 soon.